Okay, so hi guys. I'll be talking on skin grafting in plastic surgery, which is a very key technique that is used by a lot of plastic surgeons. It's globally accepted. Is a form of grafting of skin or application and grafting of skin from distinct or separate regions in the body. Skin grafting is the surgical transplant of a skin from one area of the body, that's the donor, to another recipient to cover a defect where there's a primary closure is not possible. So skin grafting is important for the purpose of wound coverage, for promoting healing, and also to restore the function and aesthetics of the area. There are several historical perspectives to wound grafting. It is believed that the Indians were the first to initially practice it 3,000 years ago, and over the years it has revolutionized and has become globally accepted by the Europeans and every other part of the world. And the skin, as we know, consists of the epidermis and the dermis. Skin has a lot of functions. It does the function of protection, sensation, thermoregulation, control of evaporation and absorption. So skin grafting consists of either transplanting the epidermis and a portion of the dermis, as in split thickness skin graft, or the dermis and all of the epidermis as well as the dermis. So just like we know, the epidermis has 5 layers: lucidium, spinosome, granulosome, basalis, and I think there's one other one, and when I remember I'm going to tell us. So skin grafting is a process, just like I said, of transferring a part of transferring skin from a part of the body to another. So like I said, it's different from a flap. A flap is where a tongue of tissue is taken along with its primary or original blood supply and used to cover a defect at its location or other locations. There are different classifications of a skin graft based on the source: the autograft, the iso or allograft, then the xenograft. Then we also have split thickness skin graft and full thickness skin graft. Split thickness consisting of the epidermis and a portion of the dermis, and the full thickness consisting of the epidermis and all of the dermis. That's the papillary and the reticular dermis. Then skin grafting is done for several reasons, which are the indications: to cover extensive wound, post-bone raw areas, after excision of scars, ulcers, tumors. Then in post-traumatic skin loss, in chronic non-healing wounds, you can do a skin grafting. In situations where cosmetic reasons are paramount, like in reconstructive surgeries, areas of prior infection with extensive skin loss, you can do a skin grafting to cover that. Then also in donor site coverage after a flap harvesting, and also in specific surgeries that may require skin grafting for healing. Then what are the conditions where skin grafting cannot be done? It's not done in malignancy in a wound bed. It's not done in infected and contaminated wound because it will not take, and in a wound that is poorly vascularized. The principle of skin grafting involves that a healthy, well vascularized recipient is available, and the graft is harvested in an atraumatic manner and handled gently. There's a good contact between the graft and the bed. Immobilization is key to prevent shearing and prevention of infection and hematoma within the bed. So for this reason, the patient is investigated, history is taken, patient is investigated, full blood count, EUCR. The patient is investigated for other systemic conditions like fasting blood sugar, conditions that may affect wound healing, any blood dyscrasia and all that. Then after that, the wound bed is prepared. So wound bed is optimized, hemostasis is optimum. Then the donor site is selected. The donor site commonly used at the lateral thigh, buttock, back, Then the donor site is selected, and the reason for this selection is because you want a donor site that has the same color with where you're taking it to. The thickness, the hair and texture, all of them are taken cognizance of before they are transplanted. Then using a Hornby knife or a dermatome, you can harvest your grafts based on the thickness that is preferable. Mesh these grafts to cover an extensive area depending on the size of wound that you're trying to harvest. There are various type of Hornby knives available. There are other type of grafting tools that are also available that are used by others. Then when this graft is done, the dermal side of the graft is placed in the bed. It's fixed in some centers. You fix using staples, glues, fibrin glues, staples, or suture to keep it in place. Then you can put a booster dressing or a negative pressure dressing within it. Then post operative care for a wound graft is one, you need to immobilize the limb or the part of the body where the graft has been placed to prevent loss. You also need to inspect your graft after 5 to 7 days. Mostly 7 days you inspect your grafts. Then the donor site about 14 days, 10 to 14 days. Although many centers have their own technique of what they do. Then the complications associated with skin grafting are: number one, you can have hematoma. There can be hematoma, there can be infection, there can be seroma collections, there can be shearing, partial or total graft loss. Then late complications, there can be hyperpigmentation, hypopigmentation, that's pigmentation changes, then hypertrophic scarring, then sites that although we can say that there are sites that are unsuitable for grafting, such as bone infected wound, highly irradiated tissues are not very good because it's believed that grafting at that location would fail. Then we also have special types of graft like mesh grafts for large and irregular wounds. We have the sheet graft for visible areas like for the face, the hand. Then we also have reverse dermal grafts, and there are some others that are available. So the recent advances, we might say they are recent advances, but in some areas or some parts of the world they are already in use. Things like the use of negative pressure wound therapy, which is believed to enhance graft take. Then also artificial dermis for deep defects. Then spraying on epithelial grafts. Then epithelial skin culture. These are recent advances that have been that are currently being used and have been tried by several plastic surgeons. So in conclusion, skin grafting is very key and is a cornerstone in plastic and reconstructive surgery. Globally, it offers reliable coverage for wounds that cannot be covered or closed primarily, and a good understanding of skin grafting is very key for a plastic surgeons. I hope this brief talk or this little lecture on skin grafting would actually help you, my listener, to understand the concept of skin grafting and also expand your knowledge and horizon concerning this topic. Thank you very much for listening.